First of all, I would like to thank Sasakawa Foundation and you for coming to FSM and starting the process for this visit. I am actually very happy and I'm enjoying the visit. I'm learning not only from the symposium and my visits with the universities, but also I'm learning about Japan on first-hand experience, not just from textbooks. When I was thinking about coming here, first of all, I was excited and looking forward to joining the symposium, meeting the medical educators and seeing how the networking is done in this region. I also expected that I would come and meet with like your supervisors and the heads of the Sasakawa Peace Foundation and actually learn more about the foundation and kind of come away with a specific idea of what was being offered. I understand we were talking about exchange program, and I know the exchange program is coming out soon. So I'm very happy and I'm listening and I'm trying to understand what I can get from all of these meetings. I see it's very positive. It's progressing well. It started out with Japan Overseas Volunteer Corporation, in which we were receiving assistance in human resources in health. And then now with JICA, extending even further. Before we would get like assistance in nursing and public health. Now we go to the other fields that are really needed, like pharmacy, immunization, and laboratory technician assistance. And so I'm seeing it as a very positive one, and I am looking forward to working more with the NGOs like Sasakawa Peace Foundation and with JICA. Overall, the Japan relationship with Micronesia, with FSM, Federal State of Micronesia, is really good. And I'm looking forward to more interactive sessions like the exchange programs, more assistance in providing training in health management and health service provision. That's a good question, because most of the dealings that we have is really like on a bilateral or multilateral government level. But I also find that the NGOs, the private foundations, even though they have strict rules, there are times that they can be very flexible, and they actually complement what the government does by providing assistance or guidance in areas that the government doesn't. For example, where infrastructure is basically what the governments are talking about, infrastructure development, health careers and health training are really the focus of the private sectors and the NGOs. And the relationship, I think it will benefit a lot, because this is going to be like a two-way exchange. How much can the Federated States of Micronesia benefit from this exchange? We've yet to see, but I'm really hopeful. We're starting out with the health assistance, and I like the idea of placing them in the rural communities. Not necessarily exactly the communities they're from, but at least as close as possible to that. And I think that's a learning experience that will last. And these also provide better means or better ways of understanding each other in terms of doing community research for the improvement of both the communities in the Federated States of Micronesia and Japan. Not necessarily using human as research subjects, but I'm talking about public health research and epidemiology research and environmental health and safety research.
Well, thank you very much, Madam Secretary. I hope you enjoy the rest of your visit here in Japan.
I am enjoying it very much, and I know I will enjoy it, the rest of it. Thank you.